Ceftriaxone is a third-generation cephalosporin antibiotic. It belongs to a class of beta-lactam antibiotics that kill bacteria by interfering with cell wall synthesis. In this video, we'll explore all the labeled and off-label medical uses of ceftriaxone, where doctors rely on it for its broad-spectrum power against both gram-positive and gram-negative bacteria. Let's start with labeled indications one after another. Ceftriaxone is indicated for bloodstream infections, often called bacteremia, which simply means the presence of bacteria circulating in the blood. It effectively targets bacteria like Staphylococcus aureus, Streptococcus pneumoniae, Escherichia coli, Haemophilus influenzae, and Klebsiella pneumoniae, all common culprits behind sepsis, which simply means a severe body-wide response to infection that can lead to organ failure. Ceftriaxone also treats serious bone and joint infections caused by Staphylococcus aureus, Streptococcus pneumoniae, Escherichia coli, Proteus mirabilis, Klebsiella pneumoniae, or Enterobacter species. Ceftriaxone is a first-line treatment for gonorrhea, an infection caused by Neisseria gonorrhoeae. It's effective for uncomplicated infections of the cervix, urethra, rectum, and throat, and even for strains that produce an enzyme called penicillinase, which makes them resistant to penicillin. Ceftriaxone also fights mild to moderate community-acquired intra-abdominal infections, meaning infections inside the abdominal cavity, like peritonitis or abscesses, that are acquired outside hospitals. It acts against E. coli, Klebsiella pneumoniae, Bacteroides fragilis, Clostridium species, and Peptostreptococcus species, though it's ineffective against Clostridioides difficile, which causes antibiotic-associated diarrhea. Ceftriaxone is widely used for community-acquired pneumonia, a lung infection caught outside hospitals. It covers the following causative pathogens, such as Streptococcus pneumoniae, Staphylococcus aureus, Haemophilus parainfluenzae, Klebsiella pneumoniae, Escherichia coli, Klebsiella aerugines, Proteus mirabilis, and Serratia marcescens. Did you know pneumonia caused by Klebsiella can create a thick, jelly-like sputum? That's one of its classic signs. Ceftriaxone crosses the blood-brain barrier, the protective filter around the brain making it ideal for bacterial meningitis, an infection of the membranes covering the brain and spinal cord. It's effective against Haemophilus influenzae, Neisseria meningitis, and Streptococcus pneumoniae. It's also been used successfully in rare cases caused by Staphylococcus epidermidis and Escherichia coli. Ceftriaxone treats acute otitis media, infection of the middle ear caused by Streptococcus pneumoniae, Haemophilus influenzae, and Moraxella catarrhalis, including strains that produce beta-lactamase, an enzyme that destroys many penicillins. Ceftriaxone treats mild to moderate pelvic inflammatory disease, commonly due to Neisseria gonorrhoeae. However, like other cephalosporins, it has no activity against Chlamydia trachomatis, so physicians must add antichlamydial antibiotic, like doxycycline, for full treatment. Ceftriaxone also treats various skin and soft tissue infections caused by Staphylococcus aureus, Staphylococcus epidermidis, Streptococcus pyogenes, E. coli, Klebsiella pneumoniae, Proteus mirabilis, Serratia, and others like Acinetobacter calcoaceticus and Bacteroides fragilis. Ceftriaxone is used before colorectal surgery to prevent postoperative infections in procedures classified as contaminated or potentially contaminated, meaning there's a higher risk of bacteria entering surgical wounds. Ceftriaxone is effective for complicated urinary tract infections, including pyelonephritis, which is a kidney infection caused by E. coli, Klebsiella pneumoniae, Proteus, or Morganella morganii. Ceftriaxone has a long list of off-label uses for conditions where it's not officially approved but supported by medical evidence. I will mention few of them and list the rest. These include actinomycosis, a chronic bacterial infection often in the mouth or jaw. Bite wound infections caused by animal or human. Chancroid, a sexually transmitted ulcer disease. Acute exacerbations in chronic obstructive pulmonary disease in hospitalized patients without risk factors for Pseudomonas aeruginosa. Diabetic foot infections. Empiric treatment after sexual assault. Endocarditis, which is the infection of the heart valves. And this is the list of the remaining off-label uses. Ceftriaxone's wide range of use makes it one of the most versatile antibiotics in clinical medicine. If you found this helpful, subscribe for more medical education videos that simplify pharmacology.